governor said earlier today that she expects tomorrow to be the day where we reach the capacity of being able to do 1,000 tests a day. I noticed that she said we have the capacity to do 1,000 tests a day. Do you think we will be doing 1,000 tests a day by tomorrow?
Yeah, I think it's possible we will be. You know, what we're seeing right now is there's more doctors' offices who've acquired specimen collection kits, so they're sending tests to commercial labs. The National Guard sites are doing more tests. Newport Hospitals had a tent up. Rhode Island Hospitals had a tent up. Kent's had a tent up. In other words, there's just a lot more people doing tests. And since there's much more availability of testing, I think it's going to be clear we're going to have that capacity. I don't know if we're going to get to 1,000 tomorrow, but you may wonder why we want to test everybody. And why we want to test everybody, this is a public health intervention called case finding. We want to find the case, because once we find the case, we can then isolate that person with confidence, and then we can quarantine those that are exposed to them. And so the case finding is something that's been shown to be effective in South Korea and in Singapore and other countries that have had some success with the pandemic. And that's partly why the testing has been so important for us to do.
And in terms of the testing, how many days does it take right now to get a test result back? Because I know the governor said by next week she wants it to be something that you can get same day. So where do we stand right now, and what is it going to take to get those same day results?
Yeah, so right now we can't get same day results on most people. The state health lab is working just Herculean shifts and doing great. And we're prioritizing the admitted patients to hospitals and nursing home patients there. And we're getting those results out to the hospital or to the nursing homes in a day or two. The commercial labs, where a lot of the specimens are going, are taking about 3 days to get results back. And when the governor was talking about something called a point of care test, we're all familiar with point of care tests. We just may not have called that. But when you go to the doc and have a rapid strep test on or a rapid flu test, that's a point of care test. So that just means it was done where you got your care. So we do expect that to come out in the next week or two. When I say that, it's the Abbott, a pharmaceutical company, been around a long time, developed a test and developed a test kit. So we expect it to be available in a week or two. I'm actually going to give you a little context here. I'm kind of amazed this happened, though. Keep in mind, COVID-19 was not a named or known disease 13 weeks ago. Now we have a test that's not only been invented, but it's actually going to be marketed and available in a week or two that we could have a result in 15 minutes. That's something that's pretty amazing to me. But keep in mind, amazing things are in demand by everybody. So we're going to have to compete with the rest of the states to get those machines and get those test cartridges. But those will become more widely available over the next few weeks and months. And this will be how this normalizes in our country and in our state. In other words, there'll come a point in several weeks or several months, just as time goes on, where the point of care test is the way we do this. So, then we'll have the results right away, and then we'll be able to do right away what we need to do.